Welcome, everyone. My name is Dana Cameron. I am the Client Services Manager here at Vantage Aging. This month for Caregiver Solutions, we have Megan McLean from Summa Rehab Hospital. Megan earned her doctorate of physical therapy from The Ohio State University in 2012. Following this, she completed a neurologic physical therapy residency at The Ohio State University Wexner Medical Center in 2013. In 2014, she became a board certified neurologic clinical specialist. From 2013 until 2021, Megan worked as a physical therapist in the inpatient rehabilitation setting at Dodd Rehabilitation Hospital in Columbus, Ohio. In 2021, Megan joined Summa Rehab Hospital in Akron, Ohio as a physical therapist, treating in both the inpatient and outpatient settings. In 2022, she took the position of lead outpatient therapist at Summa Rehab Hospital with responsibilities including both department management and patient care. In this role, she continues to serve patients with neurologic conditions, including those with dementia and memory impairment. Megan also serves as a board member of the Northeast Ohio Brain Injury Foundation. Welcome, Megan.
Thank you so much for having me this morning.
You're welcome.
Um, like Dana mentioned, my name is Megan. I'm the lead outpatient therapist here at Summa Rehab Hospital, and I'm here to talk with you all about memory and dementia care. And we have a program that we call the Memory and Dementia Care Program here at Summa Rehab Hospital, as well as driving risk assessments. So the objectives for this discussion are to discuss how physical, speech, and occupational therapy can each play a role for those with dementia or memory impairment, discuss the components of Summa Rehab's Memory and Dementia Care Program and how to become enrolled, and then discuss the Driver Risk Assessment Program at Summa Rehab Hospital and how to become enrolled. So we'll get started. So first of all, we'll dive into physical therapy. So those with dementia can certainly benefit from physical therapy services to help maintain their health and safety. Each year, 6 out of 10 people with memory problems, including those with dementia, will fall. And then after falling, there is a higher risk of death or needing institutionalized care. So those are some kind of scary, startling statistics. But the good news is that staying active every day, including with the help of physical therapy, can slow down memory loss and address other symptoms associated with dementia to help prevent some of those scary statistics from happening. So specifically, what are the benefits of physical therapy for those with memory or dementia impairment? It can help slow the decline of memory loss and thinking problems. It can help reduce the chances of falling. It helps boost mood and behavior. It helps people move better and get stronger. It reduces the risk of needing hospital care or other institutionalized care. And it improves heart health. So at Summa Rehab Hospital, there are some specific things that we work on in physical therapy for those with dementia or memory impairment. We will help them become involved in what's called aerobic exercise. So this is exercise intended to increase your heart rate, increase your respiratory rate, get you working hard, essentially. That can include things like walking on the treadmill or walking over ground. It can include cycling or a seated stepper. Really any form of exercise that the person enjoys that, like I said, can help get that heart rate up and get them moving faster. We work on strength training to help maintain or improve the strength necessary for everyday tasks. We can do this by using the person's body weight, resistance bands, free weights, or weight machines, depending on the unique needs of the individual. We can work on balance training to help prevent those falls like we talked about. We can work on things that are called dual tasks. So these are combined brain and body tasks, the completion of two activities at once, which, believe it or not, we need to do many times throughout the day. So a common example is walking and carrying something. We will help the patient develop what we call an individualized home exercise program. So these are exercises tailored to the needs of the specific patient that they can take home and do at home safely, maybe with the help of a caregiver if needed. And we provide lots and lots of education. Some of the common topics that we educate on are appropriate assistive devices and how to prevent those falls at home. So here is an example of a handout that we might send home with someone to work on exercises in standing. So these are some really common standing exercises that can help improve strength and can also address balance. So you can see that the person is in standing performing these exercises. They're holding on to a countertop for safety, but they're moving all of their major lower extremity muscles to help improve the strength of those muscles. So they're doing some marches, they're doing some squats, they're doing some heel raises. And again, these can be tailored as needed to the needs of the individual. Here's another handout that we might send home with someone. This describes ways to work on aerobic exercise. So as I mentioned, we can instruct them in how to use the treadmill at home or at a gym, an exercise facility, maybe use a stationary bike, or even as simple as just doing some walking in the community to help get their heart rate up and get them moving a little bit better. To increase the challenge, you'll see listed below that is what we call dynamic exercise. So we can add a second task to walking, as I mentioned earlier, or have the patient walk or move in different ways to challenge their body other than just moving or walking forward. So you can walk sideways, you can walk backwards, all sorts of ways to make things harder and challenge the body a little bit more. And then we can add mental training to walking. So this is a way that we can work on dual tasking. So we can have the person walk and perform counting, walk in and name objects, walk and name objects in alphabetical order. We can alter these tasks as needed based on the abilities of the individual and tailor them to what the individual might need. So one common example that we can perform is walking and reciting maybe a grocery list that a person might need to remember if they were going to go through the grocery store and collect their groceries for the week. So moving on from physical therapy, we'll talk a little bit about speech therapy and how it can be helpful, specifically for those with dementia, help maintain their health and safety as well. So even though those with dementia experience memory loss, speech therapy can still be helpful to assist these people in continuing to communicate and understand friends and family. And this is really essential in ensuring that they maintain their independence and their emotional well-being. So some specific benefits of speech therapy for those with dementia and memory impairment. It improves the ease of communication. So speech therapists can help teach ways to better express thoughts as well as ways to understand thoughts. Excuse me. It helps to maintain and sometimes improve memory skills. It can help ensure safe eating and swallowing. And it encourages social skills and maintaining social engagement. So some specific things that our speech therapists at Summa Rehab Hospital work on with those that have dementia include language exercises, so help with remembering words and building sentences, thinking exercises that focus on attention, memory, and listening skills, swallowing training, as I mentioned, to ensure that eating and drinking is still safe at home and out in the community, And then communication tips to improve the ability to have conversations and to reduce anxiety or stress in social situations. And then finally, occupational therapy is helpful for those with dementia and can also help maintain health and safety at home and in the community. So, occupational therapy can help people continue to do everyday activities such as getting dressed or cooking and a variety of other activities that people need to do throughout the day. And this in turn helps support their independence and improves their quality of life. So, some specific benefits of occupational therapy for those with dementia: it makes it easier for them to do daily tasks such as dressing, grooming, preparing meals, helps people stay engaged in household chores and taking care of personal needs. They work in conjunction with speech therapy to help improve thinking skills, especially those thinking skills necessary to complete everyday tasks. And then they work in conjunction with physical therapy to help prevent falls by improving balance and movement. So we all tend to work as a team, physical, speech, and occupational therapy, to address the holistic needs of the patient. Specifically at Summa Rehab Hospital, our occupational therapies are working on personalized activities, which are individualized based on the person's needs to help improve their daily skills. Cognitive exercises to help with memory, focus, and thinking that are necessary to do day-to-day tasks. Our occupational therapists can perform vision screenings to help identify any vision issues that may be contributing to day-to-day difficulties. And then we can work with optometrists and ophthalmologists to help address those specific needs. Just like physical and speech therapy, our occupational therapists provide lots of education on ways to make tasks easier at home, ways to make the home safer, and appropriate assistive devices to use within the home and in the community to help make things easier and safer. And they can also help with stress management by providing tips and education to both the patient and their caregivers. So, how does someone become enrolled in our memory and dementia care program? Or, I guess, first, what does our memory and dementia care program entail? So, we do have a specific program here at Summa Rehab Hospital that involves physical, occupational, and speech therapy for those with a diagnosis of dementia or memory impairment. It requires a prescription from a physician, and it consists of 1 hour sessions of each physical, speech, and occupational therapy, working on all of those skills and activities that I mentioned in the earlier slides. So these 1 hour sessions can be scheduled right in a row for a total of a 3 hour time block. But if it works better for the person or their family to come on separate days, they can do that as well. Sometimes 3 hours in a row is a lot. We usually schedule these once a week. So each of these therapies once a week. And on average, we're seeing these patients for about 4 weeks to complete this plan of care and all the activities that are necessary. This, of course, can be adjusted and altered based on the patient's needs. So we can see them more frequently or less frequently, or for a longer period of time, or for a lesser period of time, depending on their needs. In addition to all of the therapy activities that I mentioned in the earlier slides, we are coordinating meetings for those enrolled in this program between the therapists and their caregivers. And this can include the patient if appropriate, to make sure that everyone's on the same page about the needs of the patient and how to carry over what they're learning in therapy to the home and the community setting. And in addition to these meetings, we're doing education every single session with the patients and their caregivers on the dementia disease process and progression, strategies to ensure carryover at home, and community resources to help ensure the person is able to remain engaged in the community for as long as possible, as well as to help alleviate some burden on the caregivers that we do know exists during a disease process like dementia. And then we can facilitate what we call community outings. So if there's a specific location or place outside of the home, or maybe that place is the home, that the patient is experiencing challenges, we can go to that setting and help the patient and the family troubleshoot um, what might be, what the challenge might be, and what can be done to help lessen that challenge or keep that person engaged and involved in that setting. So, like I said, we can go to the home if maybe there are some environmental barriers that are causing falls or making it difficult for the person to stay home alone, or making it difficult for the person to access their home. Or maybe it's a grocery store. Maybe the person is having trouble navigating the grocery store, and we can provide some suggestions for how to do that more safely and easily. We also have at our hospital what we call our driver risk assessment program, which is often appropriate for those with a memory impairment or with a diagnosis of dementia. So this is an in-clinic driving evaluation for what are considered medically at-risk drivers. An on-the-road assessment will not be performed during this evaluation, but we can refer to providers that perform on-the-road assessments if we feel that's necessary. So this requires a prescription from a physician, and this is a 2-hour long appointment, and it's performed by an occupational therapist. So during this appointment, the occupational therapist will perform a thorough assessment of vision, cognition, problem solving, safety awareness, strength and range of motion, sensation, and reaction time, all skills that are critical for safe driving. And with the assessment, all of these skills and abilities, the therapist will make a recommendation on appropriate next steps. And this recommendation will be communicated to the patient, to the caregiver or family members that accompany them, and the referring physician as well. So this can be anything from the patient is safe to continue driving as usual, or maybe it's the patient should retire from driving, or anything in between. Oftentimes our therapists are providing recommendations on situations that it is safe for the patient to drive and situations where it might not be safe for the patient to drive. So maybe they should avoid nighttime driving, or maybe they should avoid driving in inclement weather, or maybe they should only drive in familiar locations with a loved one driving with them in the seat. So lots of very specific, very tailored recommendations depending on how the patient performs in the assessment. We will not revoke license during this appointment. That's always a concern. That's not something that we have the power to do, but we will, if we feel like the patient should retire from driving, that recommendation will be provided to the physician, and the physician will do with that information what they feel is appropriate. We sometimes need to make additional referrals following this evaluation that will help facilitate the patient's ability to participate in continued driving in some capacity. So they might need a further vision examination by an optometrist or an ophthalmologist. As I mentioned, they might need an on-the-road driving assessment with a certified driving instructor. They might need referrals for adapted driving equipment. And they might need to continue with occupational, physical, and sometimes even speech therapy to improve skills needed to return to safe driving. So how does someone become enrolled in these programs here at Summa Rehab Hospital? To become enrolled in our memory and dementia care program, we will need a prescription from a physician. It can also be from a physician assistant or a nurse practitioner for physical, occupational, and speech therapy for memory and dementia care. And for our driver risk assessment program, we will need a prescription for occupational therapy. And it does specifically need to say for IADL driver risk assessment. This is something that insurance requires. Um, excuse me, that IADL stands for Instrumental Activities of Daily Living. These prescriptions can be faxed to 330-572-7267. And if you have any questions at all about either of these programs, you can feel free to call the number or email that email address, which is my email listed on the screen here. So thank you so much for having me to talk about not only our programs, but how important it is for those with memory impairment and diagnosis of dementia to stay involved at home in the community, and the benefits of physical, occupational, and speech therapy to facilitate that. Do you have any questions for me?
Well, thank you, Megan. All of that is really helpful. I talk to so many people in my work who have a loved one with dementia or starting to have issues with memory and just kind of knowing where to start and what might help. And the benefits of therapy. I loved hearing about that. I did have a question, and I'm guessing you can do this, but with the community outing, when you said someone might be struggling in a certain area, if it's like going to their daughter's house
Yeah.
and you could do like an assessment there as well.
Mhm. We
Okay,
can go
great.
anywhere. Yeah, we can go
Okay.
anywhere in the community. Yep.
Okay,
So
great.
we will meet the patient and their family or caregivers at
Mhm.
that specific location and troubleshoot whatever it may be. And we're
Okay.
not just limited to one community outing. If they would benefit from going to multiple places, several different places, we
Mhm.
can accommodate that as well. So
That's great. That's
yeah.
super helpful because I've heard of home assessments, of course, when someone's doing their therapy, but I hadn't really heard of assessments in another setting. So I love that it gives more options. Um,
Yes. Yeah.
yeah. Well, and then I guess always my main question when I talk to people about services like this is if you have any advice or guidance on what to do or say to a loved one who's very reluctant to initiate any of these services.
Yeah, that's a great question, and I think happens, specifically in this population.
Mhm.
So I would just encourage them to come for at least one appointment. They don't have to commit to an entire plan of
Mhm.
care. And maybe, depending on where they're at in the disease process, maybe you don't even need to let them know that this could be a
Sure,
4-week program. Just let
sure.
them know that they're gonna go for an assessment by a therapy team, to help them stay engaged at home. And I think oftentimes what motivates patients to come is knowing that our goal, which is often a shared goal that they have as well, is to keep them as independent as possible. So no one's trying to hold them back from anything
Mhm.
or take any of their independence away. We instead are trying to work with them to keep them as independent as possible and keep them at home.
Mhm.
That's certainly our goal, is to keep them at home as long as possible. So usually that resonates with them. And then we can just
Yeah.
take it one appointment at a time. Um, and that usually is a good approach.
I love that approach. And I always say, I've worked with physical, occupational, and speech therapists for a lot of my career. And I always say you all are such patient advocates. And the goal is always to try to help people be independent. So that's
Yes.
a wonderful thing to focus on for
Yeah.
sure.
Yep.
Well, well, I so appreciate your time, and I will be happy to tell clients about your services because I know that this will be helpful to many people just to kind of have a place to start.
That's awesome. Yeah, thank you so much. We're just hoping to touch as many lives as we can. So thanks for having me on
Yes.
today.
Oh, you're so welcome. Well, have a good day, and thank you for being here.
Yeah, thank you. You too.
You're welcome. Bye.
Bye.